I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an April 21st, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. 8 new cases were added to Dubuque County's total since Friday. As of April 21st, Dubuque County has 48 positive COVID-19 cases, 1 in the 0 to 17 age group, 7 in the 18 to 40 age group, 27 in the 41 to 60 age group, 11 in the 61 to 80 age group, and 2 that are over 80. Also, 856 people have been tested in Dubuque County with 808 negative results. 15 people, or 31% of Dubuque County positive cases, have recovered. The state added 482 positive cases today for a total of 3,641. I'm sorry to report 4 additional deaths in the state today, all from long-term care facilities. Long-term care facility residents account for 51% of Iowa's 83 deaths. In all, there are 23,974 negative tests and 214 cases are currently hospitalized in the state, and this number has been increasing. 1,293, or 35% of Iowans, have recovered. Region Medical Coordination Center 6, or RMCC 6, where Dubuque County is located, continues with a score of 10 out of 12, which means continued reinforcement of the extra social distancing measures put out last week is necessary. In addition, 3 meat processing facilities in Iowa have experienced outbreaks within their work sites, causing a significant increase in the number of positive tests. 33% of today's tests were from surveillance at those processing facilities. The regions have to be ready for the possible hospitalizations from these cases. And remember, hospitalizations usually occur 2 to 3 weeks after symptoms begin, which is when people develop the most serious symptoms that require hospitalization. In other words, when they're the sickest. So reminding us all of the social distancing measures, which we are all sick of hearing about, I think I'm getting a little lazy on the 6-foot distance requirement. Maybe it's because I hardly go anywhere besides this recording studio. To help remind us how far 6 feet is, here are some examples. A twin bed is 6.25 feet long. The width of an average sedan is about 6 feet long. A standard 3-seat cushioned sofa, or an average door, which is actually a little bit more. Also, most people on a basketball team are 6 foot or over. I think this could be a new game, the "How far is 6 feet" game. In other news today, the governor announced Test Iowa, a statewide initiative to provide testing for up to 540,000 Iowans in the next 180 days. Test Iowa is a public-private partnership between the state of Iowa and 4 private companies: NAMI Health, Damo, Qualtrics, and Silicon Slopes. Iowa is the 2nd state in the nation to launch this initiative. The first was Utah. The goal is to test up to 3,000 people per day when the project is fully underway. So where and how will this testing occur? Testing through this program will be prioritized for those who currently have symptoms, have interacted with someone who has already tested positive, or have recently visited places where COVID-19 is more widespread. To request a test, anyone can visit the website testiowa.com to complete the assessment to determine testing eligibilities. Based on the assessments gathered from all over the state, drive-through test sites will be set up in various areas for registered individuals to be tested. You can take an assessment more than once, especially if your risk or symptoms change. The assessments ask things about your symptoms, if you're an essential worker, and the cost for the test is free. Stay tuned as I learn more information on Test Iowa. But in the meantime, it doesn't hurt to take the assessment on the website, testiowa.com, which will add to our general surveillance for the disease. And testing is one way to learn about COVID-19 and tackle it. But it's not the only answer to the pandemic. As Winston Churchill once said, "Now, this is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning." Thanks for tuning in today. Let's all continue to be safe, be smart. When in doubt, don't go out. And remember, we're all in this together.